戦後に無症状のまま退院していた男性が新型コロナ
One of the hardest hit countries, Spain. The number of infections in that country has now surpassed those reported in
500
China.
people died in the past 24 hours, and that brings the nationwide total of deaths to 31.
On January 21st, 2020, the United States diagnosed its first coronavirus case in the state of Washington, quickly followed by a second case in Illinois, then the third, fourth, and fifth cases.
Is that many hospital systems are simply overwhelmed right now. So accessing treatment, accessing equipment, accessing PPE, a lot of that stuff is just taking longer than it should right
now. Scrambling to try to get a few additional ventilators or even CPAP machines. If we could get CPAP machines, we could free up ventilators for patients who need them.
Most healthcare facilities reported that their medical supplies will run out within a week or two. In April, 36 of respondents to a survey reported that there were no more face shields remaining. In Massachusetts, 54% of the respondents had a week or less of gloves left. In locations such as New York and Detroit, the sudden spike in the number of patients caused a shortage in ventilators. Doctors had to make painful decisions about which of their patients to give life-saving medical equipment to. The shortages were caused by problems with the global supply chain and inadequate restock after the pandemic influenza. Most importantly, the stock of PPE, which was severely lacked by all the countries around the world. A combined strategy of contingency planning and resources allocation is a critical component of risk management for all organizations in the modern society. Similar to using meteorological models to forecast the weather, we are able to use epidemiological models to predict the spread of infectious diseases. Based on the statistical models established, we projected the dynamics of demand and supply for medical resources at different phases of the pandemic. We established a website, covidplan.io, which would visualize the information of demand and supply for PPE, ventilators, and testing kits for each state. Additionally, we have information regarding resources allocation, in which the user is able to select different states and get the exact amount of allocation recommendation for different medical resources. Illinois' Risk Lab COVID Plan team aims to provide real-time demand, supply information, and forecast future projections. As the COVID-19 pandemic continues, we hope that our findings can provide some reference to public policymakers, serving as the quantitative basis for efficient allocation of limited resources. Our algorithms are adaptive to the fast-changing dynamics of the pandemic and demand-supply imbalance. The framework of contingency planning we presented may also be utilized by decision makers for developing strategic stockpiling plans for the future pandemics.